technology advisor to the governor and the legislature with the mission of growing and retaining science and technology-based businesses in the state of Wisconsin. So we represent stakeholders like higher ed, entrepreneurs, investors, big corporations, anyone with sort of a stake in the innovation economy. And these joint luncheons are where tech intersects with policy. So we're super excited to be here at MCW today to talk about a really important topic that I think is relevant to all of us every day. So it is my pleasure to introduce Dr. John Raymond today. We're just going to take a moment to give him his flowers as he retires after 16 years. The Medical College has been a longtime and valued board member of the Tech Council. So I really appreciate this chance to say a few words. So Dr. John Raymond, as I think everyone here knows, has served as president and CEO of the Medical College of Wisconsin since July 1st of 2010, leading Wisconsin's only private medical school that today has a $1.8 billion operating budget and a workforce of more than 7,500 faculty and staff, which I was just talking to the MCW COO about. Today, half of all physicians, practicing in Wisconsin are alumni of MCW's medical school or residency programs, which is an extraordinary testament to the institution's reach and relevance. Over 16 years of leadership, Dr. Raymond has guided MCW through a period of remarkable growth and transformation. One such example is this beautiful building that we're sitting in. He launched a bold vision to address Wisconsin's physician shortage by establishing regional medical school campuses in Green Bay and central Wisconsin. Together, those campuses have already graduated almost 300 physicians, with many returning to serve rural and underserved communities. Recognizing the critical role of interdisciplinary care, Dr. Raymond also established MCW's School of Pharmacy, which has now graduated more than 200 pharmacists, many of whom are training and practicing in areas of greatest need. Beyond education and workforce development, Dr. Raymond has championed partnerships that connect health, equity, and community vitality. He helped bring together MCW, the Greater Milwaukee Foundation, and Royal Capital Group to create Thrive on King, an anchor investment restoring an iconic Milwaukee building and advancing a healthier, more equitable city. He also helped the Center for Forensic Science and Protective Medicine come to fruition, sitting just to the southwest of us, a first-of-its-kind collaboration opening in 2026 that strengthens public safety, education, and workforce development across Wisconsin. So I would appreciate it if you would join me in welcoming and thanking a true champion for health, education, and community impact, Dr. John Raymond.
Thank you, Maggie, for that very generous introduction, and good afternoon, everyone. We're so glad that you're here, and thanks to the Tech Council and WisPolitics for allowing us to host you today. We're very proud of this new building. It's something that we've dreamed of for a very, very long time. It brings together everyone on our campus who does cancer research, whether that's in adults or children, everything in between, populations all the way through molecules, and there's space in the building for technology-focused collaborations with non-academic entities. So we're really pleased to be in this new building, and we're so thankful that you're here with us. And for those of you who aren't really familiar with this concept here, MCW, as you heard, is a very substantial entity. And you may not know that we are the largest research enterprise private in the state of Wisconsin, ranking only second to UW, with over $400 million of research-related expenditures in the last year. That would rank us number 79 out of 20,000 research institutions in the country. So it's been my honor to be part of such an impactful organization. And so on behalf of that organization, I want to thank you for joining us. And as a longtime sponsor of WisPolitics, we really value the role it plays in delivering timely, just-in-time news and analysis. And maybe more importantly, we appreciate the value of having access to such high-quality, objective resource in these fraught times. So thank you all for being here today. It's important to bring together leaders in the same room to create space for catalytic conversations. And I'm very much looking forward to sharing the stage with these wonderful experts. I would say we had a great conversation yesterday in preparation for this, and I wish we just taped it. Hopefully it'll be as good today as it was yesterday. So Jeff, thank you very much for.
Okay, thank you very much, Dr. Raymond, and really appreciate all of you being here. Thank you, Maggie and the Tech Council. I also have to get some business out of the way. In addition to our host, the Medical College of Wisconsin, I want to thank our other sponsors, UW-Milwaukee, Spectrum, the Wisconsin Transportation Builders Association, and HBS Wisconsin. And as Maggie said, we're doing a couple of these, more than a couple, a few of these programs jointly around the state this year to emphasize topical big issues such as this. So I also want to recognize two people from state government who are here. DSPS Secretary Dan Harris. Please give him a round of applause. And Senator Rachel Cabral Guevara. So thank you very much for attending. I told them they have to ask questions, so we'll put them on the spot later. So also want to call attention to this. I think you might recognize that person's face. If you don't have this, you know, you should pick one of these up. And we also have our annual printed directory. And so I invite you to grab a copy of that, you know, for your use. It helps you identify people like the senator and the secretary. So, all right, to our program. AI, it's like, wow, it's overtaking all our conversations. But how does it impact healthcare? And especially how does it impact the healthcare workforce? So we have a expert panel here to help us. Nick Myers down at the end there, he's of recovery.com. He's director of AI innovation there, and he had his own startup in the AI healthcare field. Then we have over right here, UW-Milwaukee's professor, assistant professor of healthcare informatics, Professor Lu Hu. And so thank you very much for being here. And then we have Ann Zenk. And Ann is the Senior Vice President for Workforce and Clinical Practice at the Wisconsin Hospital Association. So all the hospitals that you know are part of the association. And so Ann's, the Hospital Association report on workforce shortages, I invite you to take a look at it if you haven't. And of course, Dr. John Raymond. And I want to give another round of applause to Dr. John Raymond because this is his place. Look what he has lit. Okay, so this, you know, we're going to run about an hour here. We're going to scratch the surface, but we're going to have a conversation. As Dr. Raymond said, we had a great conversation yesterday in preparation for this. And so we're going to plow some fertile ground and then get you to ask some questions, which will probably be better than mine. So we'll make sure we leave room for these questions. So, okay. I think we recognize that AI is a workforce tool. A lot of people fear it as a workforce tool, but on the positive side, what can it do in the healthcare arena to help bridge some of these acute shortages? And I just want to go right down the panel here and get your initial views on that. So, Professor?
Testing.
There you go.
Okay.
On.
Thank you. So I think AI is the buzzword, of course, and it has been rapidly deployed in healthcare settings faster than we realize. For example, it has been used as ambient scribes in the clinical encounters, and some of you have already noticed that. And also it has been used to respond to patient messages. So my concern is really that it's been used faster than it should be. We don't really fully understand the scale of the consequences and who's bearing those costs. And to use it to address the healthcare workforce shortage, I think there are so many critical questions that we need to address before we just say, oh, it's the solution. For example, is it exacerbating existing clinician burnout? Is it exacerbating existing inequities? Do patients trust them at all? So I think this panel will definitely explore all of those questions, and I look forward to the panelists' perspectives as well.
Okay, Ann, what's your viewpoint on whether it could be a good tool to bridge these shortages in the healthcare workforce?
Yeah, I think it could. We have to be careful, but also move quickly. The pace of change in healthcare has been accelerating for the past few decades, and AI is going to move even faster than other technology in electronic health records. That's good news because we have a population challenge in Wisconsin. All the boomers like me are retiring. And we're also increasing healthcare demand. So everyone's having a hard time finding workers, but healthcare has a double challenge: shrinking workforce, increasing demand. So we need to utilize AI to take burden away from our healthcare workforce. So that's one of the risks. What if we use it and it ends up increasing burden, trying to see more patients than a provider can function or coordinate, utilizing AI algorithms to increase insurance questions for providers, which are already weighing them down. So I have great hope that technology like automatic registration, you go to your doctor's office, register, that lets a worker work somewhere else where patient access is needed. But I also want to make sure we're truly looking at what will help patients and the workforce.
So Dr. Raymond, yesterday, I think you set out some goals, what you thought would be that AI in the healthcare arena. And I think it would be good for you to talk about those goals as you talked about, because I think that helps set the scene for, what big institutions will be doing.
Yeah, thank you so much. And I think Ann and Lou already have touched on many of these, but some goals would be to improve processes, to help clinicians make better, more streamlined choices, improve communication, improve access and the patient experience. All those things are worthy goals that can be partially accomplished with this new tool. There are some pitfalls that we're going to talk about later that we have to be mindful of, and Ann touched on one of them, which is if your clinicians are more productive and efficient, instead of taking away what we call pajama rounds, where you go home and have dinner, put the kids to bed, and then you answer all the emails you got and you review the charts and you dictate, if that's taken care of by ambient AI and some other processes, there's always the temptation for an employer to say, well, you can see 5 more patients during the day, 7. And maybe even if the institutions aren't telling you to do that, many of our clinicians are on a productivity-based reimbursement model, and so they would self-activate to do that. And so we have to make sure that we take care of all aspects of the healthcare spectrum. The providers who are already overworked, and Ann already mentioned the pressures that are coming. An aging workforce and an aging population cause a lot of issues. So those would be the main things.
Okay. So Nick, before you get into your comments, I want to stress that you're an entrepreneur in this field. Just tell people a little bit about why you chose to, start your business before you got to recovery, why you chose to start your business in this field.
Yeah, no, thanks, Jeff. A large part for me and why I even chose to pursue the path of healthcare, right, which is gargantuan as, we think of healthcare in the United States, and it's a huge hill to climb. I went through our healthcare system at a very young age. I'm a survivor of childhood acute lymphoblastic leukemia. So even at the age of 8, right, where all I knew I was getting free apple juice playing N64 in a hospital bed, I still, as by nature of going through that treatment, experienced our healthcare system. And of course, as I got older, went through college, just began really thinking about a lot of the deficiencies. And as this technology really began to take form around the 2016, 2017 timeframe, really thought about how it could be used to help alleviate these deficiencies. So I co-founded Red Fox AI 5 years ago. I like to say we're early to the AI game before you saw it on Costco toothbrush boxes, right? Because that's how ubiquitous it is right now. And we created a tool that helped with continuing education, training, and ongoing learning for home lab testing and medical devices, because that was a problem I saw my own parents continue to encounter going through my treatment. And of course, over time, as we went through that, met the folks at recovery.com, became friends with them, and we decided as this AI boom was unfolding, it made a lot of sense to partner. And of course, our mission at recovery.com is to be the best place on the internet to find treatment. So who can't get behind that? Again, solving another very big problem within healthcare. So that's how I got here.
All right. So where do you think that AI can play a positive role, before we get into the pitfalls, a positive role in alleviating burdens and shortages in the healthcare arena?
Yeah, I think the workforce shortage, as we like to call it, right? We've been talking about this, I mean, as long as I've been in healthcare, probably far, far even before that. And we know since COVID, there's been a gross decline in the number of medical professionals entering the healthcare workforce. Also, while dealing with this gross aging population, gross in the sense of large, right? Aging population.
Hey there.
Gross isn't big. We have a very large aging population. Word choice there, Nick. Think through that next time. Right? And how do you bridge that gap? So I like to always try and analyze what is the root of the problem. And the root of the problem is completely agree, of course, as we talked about in our prep call for this with all the panelists, that there is so much AI can solve administrative wise and down to the fingers on the keyboard level of clinicians, doctors, nurses, anybody in healthcare. But also, I think the root of the problem, right, is not enough people are entering programs at colleges like MCW across the country, right, to become trained in these professions, whether that be a nurse, whether that be a PA, whether that be an MD, all across the board. So why is that? I think a big reason is cost. So how do we bring down the cost? So one of the areas I actually see AI helping is, can this technology get good enough, and I firmly believe it will, that maybe it can help alleviate a lot of the stressors on the education piece too, removing that burden so we can get more people into the programs to become amazing medical professionals, because there is a substantial cost, as we know, to going through these programs. So that's where I think one very optimistic way this technology can be used as it continues to develop. And we see that happening at universities already.
All right. So now we'll try to have a conversation. As I told you yesterday, panelists, don't be afraid to take my question and direct it in the proper way, or step in when you think you have a comment to make. And Dr. Raymond said we're going to be informal, so everybody's going to go by their first name. All right. So let's just start with you, John, then, about the pitfalls. I think that we're kind of the Wild West here in the AI. We're at the beginning of this surge of AI use, and the surge is going faster than a lot of the rules or the policies. And so there's privacy concerns, there's ethical concerns, and I'm just wondering, of all the possible pitfalls, which are you most worried about as somebody who leads an institution like this?
Thank you, Jeff. I think the most concerning pitfalls change as we go forward. Initially, the pitfalls were with the quality of the data that were included in training sets and the tendency of some of these algorithms either to hallucinate or confabulate, make things up. And that was a real concern. Those are mostly, not completely, but mostly under control now. I think we're now pivoting to issues of, you mentioned privacy, the ethics of the use of AI and disclosure to your patients about how you're using their data, how it is being processed, whether it is HIPAA compliant in terms of security compared to the electronic health records. So those are real concerns, and we need to monitor those. Again, we mentioned the potential for insurance companies to use AI algorithms to increase denials, which actually would create less efficiency in the way that we run through the healthcare system. And there were some concerns that that was actually being done earlier this year by one of our large insurers. And I think as each year goes by, new concerns will arise.
Okay, so let's go, before we go to maybe employee concerns. What about what are patient concerns? What are pitfalls for patients? I think privacy. I mean, there's polls show there's a lot of distrust in the marketplace for AI. It's an unknown to many people, so they don't trust it, perhaps. But Lou, where do you think some of the problems might lie with patient concerns?
Yeah. So in my own research where I develop AI-enabled systems to help augment the healthcare workforce, for example, community health workers and patient educators, one problem that we just kept encountering is there's simply not enough established technical infrastructures, especially when we work with underserved communities. Using AI will assume they have a smartphone, they will have good enough system enabled to run those large language models or even speech recognition softwares. But in many communities, those infrastructure simply doesn't exist. And it's actually becoming a burden for the patients in order to get those software just to use AI, which isn't really cost effective for them. And the second barrier is the human infrastructure to actually create, maintain, and fix AI when there's a breakdown. And I think those are more pronounced in underserved communities and also in across the health systems, especially in rural areas. There are a lack of established technical infrastructure to establish the AI systems. And I've encountered this over and over again in my research. And even though AI systems sounds really fancy, but it's really those technical systems underlying them that are supporting the AI work. So I think there's still a long way to go to establish those technical and human infrastructures to make AI work in the first place.
So, Anne, what kind of, are you hearing from, are hospitals hearing from patients about AI, questions about AI, wariness of AI, and how are hospitals approaching that if they are?
Sure. I think anytime there's a big rapid change, excuse me, patients and families are gonna have concern. Concerns that technology or AI will get between them and their provider, right? Concerns about privacy, concerns about errors. So for our members and for healthcare providers, as proactive as they can be in making sure patients know what types of AI are being used, getting consent, answering questions, and modeling the benefits of AI. I have a neural condition, so when I see my neurologist, it has been awesome to hear him say, I'm going to put the computer away because I have ambient listening and I can pay attention to you. How would that feel as a patient and family, right? Reassuring. But we have to keep reassuring people because we have 5 generations in the workforce now. The newest generation maybe is starting to hear about AI and tech in their undergraduate and graduate and residency. The others, they're catching up just like our patients are. So MCW and our state medical schools and nursing schools are gonna be scrambling for people like you to help us understand.
Okay, so so Dr. Google was prominent, and now Dr. GPT is prominent, and I think that what are the cautionary tales for patients and families on that end? And John or Nick can jump in on that one.
Yeah, it's really interesting. We talked about this yesterday too, right? So I think as we talk about pitfalls, right, there's 2 big buckets for me, and the one that is a hill I will continue to work and probably die on is regulation. Great for all you folks in this room because we desperately need that with this technology, contrary to what the folks out in the valley think. And until that happens, we're going to continue to exist in this environment without standards, without a code of ethics, without any type of governance, yet we're trying to integrate it into an industry that, as it should be, is the most regulated industry next to finance we have in this country, right? And especially when you look at cost of care, this is where that piece comes in. As cost of care continues to accelerate, it's not expected, at least in the foreseeable future, to go down, right? People who can't afford insurance, people who don't have insurance, people who might not even have the opportunity to be on Medicare or Medicaid with all these policy changes coming out of Washington are going to try and find ways to get care. There it comes in Dr. Google. Now comes in Dr. ChatGPT, which, don't get me wrong, example, I had my wisdom teeth pulled 2 weeks ago. Never had this happen. Ball of anxiety. Take pictures of my mouth, give it to ChatGPT. By God, it's real good. I'm not going to lie. It's real good, and especially with the post-op piece of this. That said, though, it still is not a trained medical professional that has dedicated their lives and years upon years of schooling to understand the medicine and the science behind that in the context of me actually being a person. And we can't lose that. But I do fear, again, as costs accelerate, people are going to be migrating to these tools more and more. And without regulation, bad things possibly could happen. I don't mean to be hyperbolistic there, but I think we all know when we go to Dr. Google sometimes, it always tells us 99% of the time we're going to die. So.
So it sounds like there's a communication challenge for the medical community to its patients, John.
Yeah, so there are three aspects of this that I'd like to touch on. First, the quality of the data that you input into these AI tools matters. So if a patient can't put in all of the details that matter, the summary that they get may be perfect based on the information that was given, but it was incomplete or flawed. So we'll start there. Second of all, context matters. Okay, maybe a little less so than when you were trying to look at WebMD to get advice. Now you get a nice, beautiful summary that comes out. But still, you're not a trained medical professional. You can't say, if they always say there's a risk of dying from a procedure or whatever. Putting that into context for the risk and benefit of doing a particular procedure is not something right now that AI tool is going to do for you. And Jeff, you mentioned not trusting AI algorithms. People don't trust science, institutions, hospitals, and healthcare providers now like they did before the pandemic. Some of that's on us. Most of it is not. Most of it is due to the fractious politics that we have in the country. And I would say we are going to encounter circumstances in which a skeptical patient will trust the AI more than they trust their provider, and that's a problem.
That's a scary proposition. So doctors must hear this from patients, but my phone says X. So the counter to that is, I don't know. That's a challenge, I think, in any medical setting. So, there's wonderful things that happen, right? AI can scan, X-rays faster than, humans can, and they can find tumors that, weren't found before. But I think these everyday pitfalls, the ability, I think, John, you also mentioned this, prevention. One of the great goals is to prevent the people from getting to the hospital in the first place. Maybe AI can help with that, but we're working our way through it. Okay, so now I want to ask about employers. I think Nick once told me the first time I asked him about AI, he said, "There's going to be a huge jobs wipeout, Jeff." And I said, "What?" And he goes, tens of thousands of people. And I said, "What?" Okay, so now we're talking, though, I think we have a more nuanced view of what this, but I do think there's fear in the employment sector about, is AI going to take away my job? So how is this all being greeted by employees, and how can AI help refine their mission?
Might I? Just because you teed that one up.
Okay.
So in context, last summer was real busy in the world of AI, and all these things were being said, and me in typical fashion did some research, and Jeff and I might have had lunch, and I might have been a bit, oh my God, Jeff, the sky is falling. That said, labor market is going to change. The sky is not as falling as much as I thought it was last summer, right? We can only act on the data that's presented to us. All that said, I think as it relates to how the labor market is going to change, especially as it relates to healthcare, right? Being in this as long as I have, it started out, there was a lot of excitement, brand new, shiny. Then we moved into okay, I'm actually going to try and use this phase. And at the same time, we get all this messaging out from the Valley and the coast saying that, yeah, 50% of white collar jobs are going to be gone in 5 years. Totally disagree with that at this point, but they have to raise money. And then we now move into people at a place of business, in a clinic or a hospital or a medical institution, using Copilot, using an Epic AI, which I have not used. I'm not going to comment on that, but I have used Copilot, and hopefully no one from Microsoft is in the room. It is a bad product with bad data. And if that's somebody's first experience using it, they're not going to like it, and they're going to have a very sour opinion.
There goes my offer for Microsoft to be a sponsor.
I mean, I'm been in this a while. I'm just being candid, right? And now there's an anti-AI sentiment bubbling up. And I think we all can see this. If you're online, you definitely see it. But depending on the circles you run in, you can see it. My whole job at recovery.com is our director of AI, right? And from the outset, my main mission has been to build this from the bottom up with the team. And I encourage that approach for everybody, especially in healthcare. Like, nobody likes it when top-down mandates come, you're forced to use a tool you don't know how to use. People get angry because they, one, don't know how to use it, but two, they're being forced to use it. And then that creates dissatisfaction, and then that's how a movement like anti-AI begins. But I find with recovery.com, at least what we did is we built from the bottom up with our team, got everybody down to the individual contributor level aligned, and then we found niche workflows and products that they could measure. And then we built on top of that and kind of went up versus top down. Not saying that can be applied to healthcare. I think it can be applied to any organization. But I think in this environment where so many people, especially I have some friends in healthcare who are also becoming dissatisfied with it now, I think that's one way we could try to work to avoid it.
Okay, so Lou, I wonder whether you have any insight on employees, how employees are dealing with.
Yeah, so I was actually, after our rundown yesterday, I was actually checking the statistics, and there was a survey distributed by the American Medical Association, and they surveyed clinicians on their AI usage. So it looks like in 2026, there are over 80% of clinicians who are already using AI in their everyday practice. And this number doubled from the number from 2023. So it's a very rapid adoption trend. And they also surveyed on their perceptions of whether they trust AI. And they cited on their, for example, their fear of losing their autonomy if AI is doing all of their decisions for them and they don't really have the autonomy to decide based on their own knowledge. So I think there's still, from the research perspective, we don't involve clinicians early enough in the AI development, deployment, and all of the policy making. So if I were to be able to take a part in this, I would more advocate for a participatory AI development, that we involve the end users, which is in clinicians, early enough in the process. So we foresee a lot of those problems. How do we make them to feel that they have the autonomy, they have the control, they trust the system? So instead of a top-down procedure, we involve them early enough, and I'm looking forward to hearing if that would actually work in practice.
If I can add, not only do you have to do, involve the people, but also ask the right questions, right? If you go on Chat or GPT and type in a question that's not quite what you're looking for, well, you get garbage, right? So if healthcare leaders and education leaders look to AI to fix something that's over here, they're not going to get the results that patients and the workforce need. So you have to look at what problem do you want AI to help with? What will best serve the workforce and patients? So, for example, I was at a rural hospital and critical access hospitals have a small number of patients and a small number of staff, but they treat a wide spectrum of conditions. They have full service labs. I toured the lab and the lab tech showed me AI and a computer screen that does what their tired eyes used to do. Count those cells, then they double check. If there's something abnormal, they contact the provider. We're always gonna need people, but those lab techs can stay in the workforce longer if we take some of the physical and mental burden away. Same with physicians. In this year's annual WHA workforce report, we cite a study that showed 2 years more or less in practice by physicians impacts workforce shortages and access by 16%. If AI can help physicians work longer, we have better access.
You want to weigh in on this, John?
Um,
About employee concerns?
Again, I think what I'm hearing from our clinicians where we are right now, everybody's using ambient AI. They're reducing pajama rounds. Their quality of life is better. Their fear is that we will then say you need to see more patients and be more productive. And we do have a real problem with burnout, and that may contribute to people retiring early. The issue of trust and demonizing healthcare workers late in the pandemic also led to flight from senior clinicians, and that is a real issue. I actually hope that AI not only can improve the day-to-day life of our clinicians, but elevate the autonomy and the decision-making ability of non-physician clinicians, PAs, and advanced practice nurse providers who are very capable. And I'm hoping that that will really help address some of the workforce shortages. Some older physicians may be concerned about allowing more autonomy in this team-based healthcare system to non-physician providers.
Okay, so Nick mentioned government regulations. That's okay. So I think I'm going to count you as a pro-government regulation in this field. Now, what they are, that's another thing. But let's talk about before I go to the audience for questions. Should the government step in here now? The White House, I guess, is reviewing some of the AI platforms. That seems outside of the usual pathway for regulation, but at any rate, is there a way for states or the federal government to step in an appropriate way on AI? Who wants to tackle that one? Go ahead.
I'll start. First of all, I think there are opportunities for regulations to be good. So if the market won't create interoperability, then the government should say, here is the framework in which you need to operate so that we're not having all these different, like we have with electronic health records. Still, even with one vendor having different instances of their program, having difficulty talking back and forth. People move all over the country, and we have that issue. So I think a framework for interoperability is really important. I think some quality standards for the type of data that are inputted in the learning environment and the testing environment for these AIs to improve the quality of the output is absolutely necessary. It's the Wild West right now. You mentioned a vendor that you hope to get someday that we won't mention again. And their program, they scraped everything from the internet. There was very little curation. And so what you get is a confusing mix of very high quality data with misinformation and outdated information. And so I think that's also an opportunity. And I do think having some standard of compliance with HIPAA and other privacy regulations that is uniform and across the board is necessary.
I would just weigh in that are there lessons now that we've learned after 25 years of EHRs that we should apply to AI in terms of standardization and guardrails that aren't mandates. We have to leave some room in there for change and learning. But that's what I think about. But
Yeah. So I think more from a technical perspective, healthcare, it is a big industry. A lot of those tech companies want to come in, but they review very little about their models, the data they were trained on, and also the problems with their models. Even though some of those models claim they're open source, they don't really review their training data or the source code of their data. So I think from a regulation perspective, if those tech companies and models want to enter this industry to be used for healthcare purposes, I think to some extent, they should be regulated to review and even audit of their models to make sure that they're safe before they're being deployed. But right now, we don't see that happening.
Might I chime in on this one, Jeff?
Yeah, sure. Go ahead.
All right, the regulation one quick. I will promise to keep this thought brief. I think first it's important to note here that every single CEO, maybe not every, most of them, of the biggest AI companies today have all said this technology, as it evolves, will be on the equivalent of a nuclear weapon. Now, riddle me this. Do we let private business build nuclear weapons? No, we don't. We have the Atomic Regulatory Commission, I'm not even sure that's the federal agency, it's around that though. And we have strict international law and standards governing the development and use of nuclear weapons. And that's this whole reason we're supposedly in this conflict with Iran, right? Politics aside, is nuclear weapon. So to entrust private business with the development of a technology that can be that equivalent needs standards. It needs regulation. And when we take this apart in the context of healthcare, I agree with everything that John said, right? Because you look at HIPAA, seldom is HIPAA updated to reflect the times, and it hasn't been in a very long time. How are we supposed to integrate a technology that consumes the world's data that we're all producing, without any type of guidance to fit that into one of the strictest privacy regulations we have as it pertains to healthcare? Nothing is being done there. No code of ethics, as we've talked about. Medical professionals are firing from the hip on how we can actually give this to patients, right? Again,
We're firing from the HIPAA.
we're firing from the HIPAA. But it is, Jeff. Right? So this lack of guidance is only going to create more distrust, and we run the real risk of this technology as it continues to actually causing harm to somebody. And I get it. I'm in this space. I'm working this technology. Shouldn't I be this optimist? I am, but I also believe in doing the right thing. And the right thing is informed legislation that isn't driven by just earning a profit on the technology itself. So my perspective on this is, in order for this to be deployed properly within healthcare, just a basic of something, the federal government saying, hey, let's crack open HIPAA. Let's update, XYZ line, ensure there's solid privacy standards, and maybe that's where we start. Or maybe we put a restriction on AI can only address the specific type of request as it relates to medical information for the average user being a consumer product, right? Again, I'm just, firing from the HIPAA. There's all these open questions on this, but
That could be the title of your blog. Okay.
that's where I would start.
All right. We have a question from the audience. We have about 15 minutes, so formulate your questions.
So I just want to point out, I sketched out all my questions on this paper towel here. That's how AI said. But it's kind of important that I share that with you because I'm Rachel, senator here in the state of Wisconsin. I also chair health for the Senate. I'm also a nurse practitioner who still likes paper charts. but we only have a couple of those. Some of the things that I get down in Madison are emails after emails, and some of the ones that I've jotted down here, I just want you guys to be aware of. I've had patients email me about transparency in regards to replying to certain questions. I know that there's some people that want to do legislation down in Madison that's about transparency. If you're replying back, is this an AI or is this actually a nurse? Is this actually a therapist? I've also had questions about, I know it was mentioned earlier, about transcription. So patients might want to videotape or record in a room, and that's not always looked upon, that's frowned upon, but yet we have providers that are doing that now to transcribe their notes. Is that a concern? I've had people ask about liability. You talked about ChatGPT. You know, you type in your stuff and then you get some crappy medical advice that now ends in bad results. Who's liable for that? These are things that have been asked of me. Again, I write things on paper towels, right? But they want me to come. I've had insurance companies contact me. You talked about prior auths. That's a big issue. And people are saying there needs to be policy around that. I've had people, I mean, it's all coming. And I'm like, let me get out my paper towel and write down some notes here. So I guess my question to you would be, who is doing this right? I know this summer we're going to be doing a study committee in Madison in July and in August and looking at policy, because there is going to be some. You like it or not, there will be policy around this because it is such a hot topic. And so I ask all of you, first of all, reach out to me if you have some ideas or want to work on this study committee. But what state or what agency is doing policy that we can try to mirror, or else I'll jot down some notes and come up some good stuff for you down there that we'll be going through health committees. So looking for partners in this, but also who's doing it right so that Rachel isn't your leader. And I'm not a good leader in this area. So thank you.
All right. Thank you, Senator. Okay. Who wants to, I guess, provide some guidance? Go ahead, John.
First of all, I love to write notes on napkins. Good job. It still works. And anyway, Senator Cabral-Guevara, thank you for the questions. I'm not sure any of us know who's really doing it well. One thing that I know is all the healthcare providers, all the health systems that we work with are really scrambling. They want to disclose. They want to be ethical about the way that they use AI. They want the patients to be partners and to be well informed. But each and every one has a different way of dealing with the issue. And we're in the early phases of even thinking about why this matters. I will tell you, when ambient AI came out, everyone just said, of course, no one's going to care. It makes my life easier. It makes the notes better. Obviously, patient care is going to be better. And it took a few patients to say, what are you doing with that? And how is that different than if you type it into the electronic health record? So I applaud you for wanting to find out best in class work. And I hope that that's the way that you'll approach legislation, is to bring in the people that are actually doing it. I know Anne had a few ideas that we were talking about yesterday about how hard this is.
Mm-hmm.
Anne, what are hospitals doing? Is there a leader in the field, so to speak?
No, I think that we're going to have to figure out a way to bring the right experts together, because AI is not just technology. It's really, I want to say complex, but that sounds like, of course, and we have to think about, I lost my train of thought, so sorry. I love the idea of bringing people together. There are several states, mostly West Coast, who have started legislation. And then as they try to implement, AI's already ahead of the implementation. So that's gonna take some good work. There are also lots of health systems, Freighter, Mayo, UW Health. We have internal efforts going on. So if there's a way we can bring those experts together, that will be helpful too, because those are the people actually doing the work. We can't forget about that top-down concern. If government does it top-down, that's a mandate. If we pull experts and frontline clinicians in, we have a much better chance.
Lou, do you know of any states or systems that are, in your mind, doing it right?
I don't necessarily know any states that are doing it right. But I'm aware that Illinois, I think last year they banned the use of AI. I think is a really interesting case because I'm not sure who is driving this decision and how patients perceive this, because mental health AI is probably one of the fastest growing industry for patients.
I think that's where you come in.
No, I can actually address that one, right? And that's something we often talk about, right? At recovery.com, we're not in the business of actually delivering the care. We're meant to be a connector between the patient and the treatment center, right? But in our industry, a lot of conversation. I was just at a conference in Nashville, Tennessee several weeks ago where this topic came up, and very familiar with that law in Illinois. And that was reactive to the cases we all heard about where there were adolescents who were using ChatGPT, or I think there was another AI tool. And unfortunately, it drove some of these adolescents to suicide, right? So of course, government does what it does, and it's going to be reactive. I don't necessarily disagree with the intent of that law, because it's like we have to do something, but I think that still speaks to a wider need to apply broader regulation to some of these nuances within healthcare, especially something like mental health, which you're right, is one of the top use cases within healthcare for these AI platforms right now.
Thanks, Jeff. So obviously in our work with professional regulation, the big question everybody's asking is sort of how does this adjacent technology impact that? And that's not really going to be my question. I think that's more of a statement here that's relatively straightforward, right? At the end of the day, at least from our perspective, the professional remains the responsible entity for the care being provided. And the rest will be litigated, I'm sure, at some point. But the undercurrent of what you're talking about, sort of since the beginning of this, is how do we build trust both in providers and in patients in the technology, and as a result support the use cases that actually bear out as being useful. So first a question and then maybe a statement thereafter. Are you using AI to currently improve compliance with regulation and as a result drive down risk, drive down liability? And if you're not, maybe that's a good starting point to start to build trust both with providers who see the benefits of driving down liability and patients who see then hopefully decreased risks as a result of that.
All right, that's interesting. So can AI help with compliance, which, as Nick said, healthcare is one of the most regulated fields in the U.S. Anybody?
Go
ahead.
I'll just start. Yes, it could. Our clinicians, when they publish, have an obligation to disclose potential conflicts of interest. And right now, we manually interrogate available databases and try to assemble them to see if people are being compliant. And then you have self-disclosure and annual conflict of interest forms. That should all be able to be automated instead of being done manually, and the quality should improve. So that's one small area where you could absolutely improve compliance. It might be a little trickier within the patient care, the clinical environment, to do that.
Anybody else want to weigh in? Other questions? Just raise your hand. I'll come to you.
I have one thing to add. Just as when we try to use EHRs to build compliance, many times it adds clicks, and then people become deaf to the reminders or clicks. But when you think about clinical compliance, there might be ways we could hardwire that with AI, that you have no choice to do certain things before you can get to the next step. But I have to think about that.
Thank you. My name's Justin Blinsky. I work with we've seen how AI can go horribly wrong when it comes to as a diagnostic tool. There was a case in, I believe, Nevada, where a nurse was working with a patient who had a sepsis monitor that went off, saying that this person has sepsis, and it turned out that it was actually something to do with their diabetes. And so the recommended treatment that the AI had said was you need to push fluids. And if they would have done that, that actually would have endangered the patient's life. So the nurse went to their supervisor. Supervisor said, trust the AI. They went to their other supervisor, and the doctor came in and said, oh no, let's do this other treatment. So nothing actually went wrong, but it was very, very close to possibly costing a patient their life. So do you see as a solution to this workforce issue in AI, being able to manage it safely, implementing something like staff to patient ratios, or having more collective bargaining among nursing staff, the frontline staff, so that they can have a built-in sort of power base to discuss these changes in their workplace that are happening very quickly?
It's interesting. I think that's a perfect example of context where the AI was using the data that it was trained on. Sure, it might have had all the data, but it didn't know the specific context part, right? Which we know medical professionals, that's what they take into account as they make these decisions, especially in a situation like that where you have to think very quickly in order to potentially save somebody's life. Yeah, I definitely hope that, and maybe John can speak more to this, that at the hospital level specifically, there's more, if not a formal group, some type of working group. And I know you mentioned collective bargaining or union or something like that, but even working groups within hospital staff to discuss this before implementation and saying we're finally going to trust this, even though the AI does not know the context.
Yeah, I think the other context there is a nurse is not a nurse is not a nurse. So staffing has to be matched with not just patient needs, but also the training and experience of the nurse and the providers involved. So when the situation came up, thank goodness, people knew enough to get involved. So an external mandate wouldn't necessarily support that. It's that ground up local expertise that we need to really make sure AI can support and vice versa.
AI is a tool. This is a perfect example of why we are not ready to have AI replace clinicians.
Thank you.
It's also a great example of the doctor better listen to their nurses who are at the bedside. One of the lessons I learned early in my career, the more eyes and experienced minds you have working on a case, the better off people are going to be. So we need to be careful about this whole idea that somehow physicians or nurses are going to lose their jobs. I just don't see that happening. It may happen someday in the future, but not anytime in the next 5 to 10 years for sure. So I don't know that you can regulate people listening to other experienced healthcare professionals. It's just something that they need to learn in their education process.
Well, medicine is a science, but it's also an art.
It is an art.
It's you understanding your patient, and AI can't substitute for that.
Okay, so here's the last question. Introduce yourself and ask the question.
Thank you, sir. Good morning, everybody. I'm a guest today. Thank you for having me, and thank you to see everybody here. I'm Clinton Gallagher, and there's a lot of me's out here, and we've been kicked to the curb. I have 40 years of experience in regulatory compliance in government and IT. 40 years. And I want to address a question to Dr. Raymond, because you're closest to a very dear subject of mine right now, which is the public-facing relationship of all these people using your public-facing websites that you've only touched on. Second point I wanted to bring up to the gentleman next to you is that there is governance. It's already established. Everybody is well aware of ADA. Your websites have to be accessible. That's creeping into AI. And AI, surprise, is the new regulator. They're telling us the rules. And they've established a whole form of governance that through their collaboration of their business operations, implemented into their rules and their training and their software of these large language models, has certain requirements of all of us to establish our experience, our expertise, our authority, and our trust. You're going to hear about EAT big time over the next several years, especially as it pertains to your public-facing website. So I want to ask Dr. Raymond, if you have any idea on how you could proceed next. I'm going to be hanging out, and I want to get back in and help. And I want to close this out with a little anecdote of my own. 40 years ago, I developed an architecture and integrated into the Children's Hospital of Wisconsin when it first got built. That building operates its facility on the IT I devised. So I have a book, I have some credentials to put on the table, some accomplishments, but this kicked me out of the business, out of the socializing. There's lots of me out here. Here's your opportunity to try to get some change going on in a way that we can help. Thank you very much.
Okay, well, thank you very much. And so I think that there's a way to close on that is you talked about ground up. The senator talks about a study committee. Obviously there are broad concerns in the community and in the tech community about AI, and so people want to help. So it's like how to marshal all these voices in policy. So why don't we just close on that? How can we make that happen?
Yeah.
Let's just go down the list.
I can start. So as a researcher, I think my responsibility is to conduct rigorous long-term research to assess AI's ability and also pitfalls. But unfortunately, there's been a sharp decline of federal funding in supporting those type of research. So research will provide us the comprehensive assessments of AI models in healthcare. So as a researcher, I would really call for bringing back those research fundings to support our projects and to bring us the scientific understanding of AI in healthcare.
How do we marshal all the voices that you're talking about, Ann? You're talking about the ground up, so.
Yeah, so I think we're fortunate in Wisconsin that hospitals and health systems compete, but we also collaborate. So anything we can do with our other partners to bring people together to talk about what they're doing, to share information, issue cautions, will be really important.
Well, maybe to address Clinton's question a little bit here is when we bring expert groups together, we can't forget people that have experience and also have insights that you may not get from a lay consumer, somebody that has technical expertise and an understanding of how health systems are built up. And they are also consumers of healthcare and want to be able to contribute. So broad and inclusive would be the goal.
Nick, I'm afraid to give you the last word, but you have the last word.
I'm going to leave on an optimistic note.
Oh, I love that.
Well, and it's easy to get caught up in all of, the pitfalls, and I appreciate this group because, there's just such expertise here to have this candid conversation. But, all of that aside, Robert, when we look at healthcare and the enormous problems that face us with it, I'm a firm believer that every person deserves the best quality of care they can possibly receive. And unfortunately, at least in my lifetime, we've done good, but we haven't been the best, and we can do a lot better. And this is a unique opportunity with this technology, if regulated appropriately, put in place by experts who have years of experience within their respective fields to do it. It can fundamentally transform how we deliver care. I fully, wholeheartedly believe that. And I think we will see that, and especially in Wisconsin being such a healthcare-focused state, I can't think of a better place where we can do this the right way and be a leader for the rest of the country. So that's my optimism when it comes to this. But again, let's make good policy.
All right. Well, thank you, panel. Thank you to Wisconsin Technology Council for partnering with WisPolitics State Affairs. Thank you to our sponsors, the Medical College of Wisconsin, of course, which is our great host today. I want to thank the staff, Holly, Ashley, and Jason, for helping me make this happen. And the UW-Milwaukee is another sponsor, Spectrum, the Wisconsin Transportation Builders Association, and HBS Wisconsin. And thanks to our webinar audience and all of you.